I'm busy streaming to YouTube. What's wrong? Yeah, so it's streaming to YouTube, but no one's watching it. So
To stay in the table. Yeah, I didn't just go there.
take over the team.
Hey, I didn't cut my hair.
And also, I'm sure you would have maybe had a different shirt,
Yeah.
chief. Not that I care, because look. I will go sit in Parliament like this. I don't care,
I hate wearing formal
Chief.
clothes.
I can't. I don't understand it.
I'm comfortable like this.
Sure, Chief. Wearing a suit doesn't impact my ego. It doesn't impact my self confidence. It doesn't impact.
Oh,
All it does, it makes me awkward.
thank you. Thank you. There's nothing wrong to be awkward. Yeah, see you.
Let's wait. Okay, sure.
This one and open my speech. Just here. Where it is. And then, I can just, yes, I'll just switch. Okay. All right. Right, why did I hear that? Are they talking?
Hi, can you hear us? We can't hear you. Are you muted? Hi, Eileen. They are.
We don't hear you.
Can you hear us?
Good morning, Commissioner. Sibanyoni, good morning. The Provincial Manager of Mpumalanga, it's good to see you as well. Good morning, everyone joining online. My name is Eileen. I'm the Provincial Manager of the South African Human Rights Commission in the Eastern Cape. Thank you for joining us. Thank you for being here for the launch of the Eastern Cape Provincial Office's inquiry into malnutrition and the right to food report, which we are presenting to you live from East London, as well as Mbombela today. The process for the program will be as follows. We will be handing over to the chairperson of the panel of the inquiry, Commissioner Jonas Sibanyoni, and he will be presenting the key findings of the commission as well as the recommendations. From there, we will be closing this session and opening it up for questions and answers, which you will then be able to pose to the panel. Commissioner Sibanyoni is currently in another inquiry, and he will be leaving us at that point, but any further questions and comments can be made to us, and we will try our very best to assist you in answering the same. So without further ado, Commissioner Sibanyoni, can we hand over to you to take us through the findings and the recommendations in respect of the Human Rights Commission's inquiry?
Thank you very much, Provincial Manager Dr. Carter, and good morning to everyone who have joined, and then those who are listening, because the launch is streamed live. And then this is the findings and directives of the South African Human Rights Commission on the malnutrition inquiry held in the Eastern Cape that took place in August 2022, or as other people say, 2022. Today, we gather here to present the findings and recommendations arising from a comprehensive inquiry carried out by the South African Human Rights Commission regarding the critical issue of child malnutrition in the Eastern Cape and across our nation. This inquiry was launched in response to a growing wave of distressing complaints received by the Commission and intensified by heart-wrenching media reports. These accounts underscored the alarming prevalence of child malnutrition and hunger, which had devastatingly led to the loss of young lives in our communities. The Commission, as a constitutional body, deemed it imperative to investigate this dire situation and delve into its root causes. During the inquiry, a diverse range of stakeholders provided valuable evidence, including concerned citizens, parents, educators, healthcare professionals, representatives from the civil society organizations, and officials from government departments. Their testimonies served as a powerful reminder of the profound impact of child malnutrition on our society and the urgency of the issue. I will now be reading the findings emanating from this important inquiry. The full 94-page report, which has a detailed account of the evidence provided the Commission, will be available on the Commission's website after this briefing. I now start with the findings. The right to dignity. The Commission finds that the state's failure generally to prevent child malnutrition in the Republic, and in particular the Eastern Cape, constitute a violation of the right to dignity of all children affected thereby. In particular, the Commission finds that the inadequate child support grant, the CSG, and the exclusion of children in early child development, ECD, centers from the National Schools Nutrition Program, the NSP, infringe upon the right to dignity of children nationally. The child support grant in its current form fails to provide for the basic needs of children, including proper nutrition, which affects their physical and psychological well-being. Similarly, the exclusion of certain vulnerable children in the ECD space from the NSNP. I want to talk about the various rights. The right to life. The malnutrition and malnutrition-related deaths among children in the Eastern Cape, as evidenced by the data on child mortality due to the SAM, indicates a violation of the right to life. The state's failure to ensure access to adequate food and nutrition directly contributes to preventable loss of life among children in the Eastern Cape, constituting a violation of their right to life. I now come to the right to food. The Commission finds that the right to food in Section 27, subsection 1b of the Constitution has been violated across numerous levels of government. The evidence presented demonstrates that many children in the Eastern Cape and South Africa as a whole lack access to sufficient food, leading to malnutrition and hunger. The state's obligation to take reasonable legislative and other measures within its available resources for the progressive realization of this right has not been met. This violation is evident in the enduring child malnutrition crisis in the province. Even if the state were to argue and even show, however, that it was taking reasonable measures to ensure the progressive realization of this right, the right to basic nutrition afforded to children by Section 28, subsection 1c, as set out below, is immediately realizable and renders any progressive measures inadequate in the context of this inquiry. I now proceed to the right of the child to basic nutrition. The Commission finds that the right to child to basic nutrition under Section 28, subsection 1C of the Constitution has been violated. This violation is especially pronounced in the context of severe acute malnutrition, the SAM, severe acute malnutrition, and the resultant child deaths in the Eastern Cape. Section 28, subsection 1C is immediately realizable, and the state's failure to ensure that children do not go hungry constitutes a violation of this provision. I now proceed to the right to equality on the basis of age. The Commission finds that the disparities in access to nutritional support, such as the NSNP, based on school attendance, violate the right to equality. Children who are below school-going age and who attend ECD centers are excluded from this vital program, resulting in unequal access to nutrition on the prohibited ground of age. The next is the right to equality on the basis of race. The Commission finds that the state's failure to adequately address child malnutrition constitutes indirect unfair discrimination on the basis of race, given that child malnutrition affects Black and colored children in severe disproportion to white children. These findings underscore systematic issues in the provision of social services, the need for an increased child support grant, the imperative to extend the national schools nutrition program to the ECD sector, and the agency to implement effective strategies to combat child malnutrition in the Eastern Cape and South Africa as a whole. These violations reflect the state's failure to fulfill its constitutional obligations to protect and promote the rights of children, particularly in the context of nutrition and hunger, and the fight against racial discrimination. I now come to recommendations by the Human Rights Commission. In light of the deeply concerning state of child malnutrition in the Eastern Cape and South Africa as a whole, and recognizing its implications for the fundamental rights to dignity, equality, life, and the rights enshrined in Section 27 and Section 28 of the Constitution, the Commission finds it imperative to make recommendations aimed at addressing this crisis comprehensively. Therefore, and in accordance with the South African Human Rights Commission Act, which empowers the Commission to make recommendations for the promotion of fundamental rights, the Commission recommends the following. Number A, National Department of Social Development, the DSD, collaborate urgently with National Treasury to explore the feasibility to increasing the child support grant above food poverty line, ensuring that it effectively addresses the nutritional needs of children. Number two, investigate the possibility of implementing a staggered rollout of the child support grant increase, starting with children under school-going age, that is 0 to 5 years, who are most vulnerable to malnutrition. Number three, collaborate with the Department of Home Affairs to explore launching a registration campaign targeting unregistered children, ensuring their eligibility for social assistance programs, including the child support grant. Number four, provide the Commission with a report in which efforts towards responding to the above are receipt thereof. I repeat, within 3 months after receipt thereof. Number B, National Department of Education, DBE, Number 1, collaborate with the National Department of Social Development to explore the possibility of expanding the National Schools Nutrition Program, the NSNP, to early child development centers. This will ensure that young children below school-going age have access to nutrition or nutritious meals, promoting their well-being. Number 2, provide a comprehensive report to the Commission outlining the Department of Basic Education's plans to increase the number of registered and funded early child development centers. Additionally, detail potential strategies for raising the ECD subsidy to enhance the quality and accessibility of early education. Number 3, investigate the possibility of expanding the NSNP to include weekends and school holidays, providing consistent access to meals for vulnerable children. Number 4, urgently roll out a supplementary program that encourages teenage mothers to breastfeeding their babies. Number 5, provide the Commission with a report in writing efforts towards responding to the above outline within 3 months after receipt thereof. So the time frame is 3 months. Number C, Eastern Cape Department of Education. Ensure access to education for a child without birth certificates. Take immediate steps to provide funding to schools for children attending schools without birth certificates, ensuring equal access to quality education for all. Number 2, conduct a comprehensive NSNP budget analysis, furnish the Commission with comprehensive data on the NSNP budget allocating for the past 5 years and compare it to food inflation rates. Include calculations and explanations for any discrepancies and outline reasons for not increasing the subsidy during this period. Number 3, strengthen support for ECD centers. Provide a list of actively supported ECD centers per district and detail the forms of support offered to help them meet required norms and standards for registration. Number 4, address unregistered ECD centers. Compile a list of unregistered ECD centers in the 39 identified wards and outline intentions to support them with conditional registration, funding, and assistance to meet required norms and standards for operation. Number D, Eastern Cape Department of Health. Explore the feasibility of establishing nutrition-focused early child development clinics in partnerships with the Department of Social Development, providing regular checkups, growth monitoring, and nutritional counseling for children under 5, particularly in vulnerable communities. Number 2, explore the development of comprehensive program for the early identification and treatment of malnourished children, including the provision of therapeutic foods and medical care with a focus on SAM. Immediately make available data to NGOs upon request, which may allow for targeted interventions and assistance in respect of food aid and supplements in specific wards and communities. Provide the Commission with a report in which efforts towards responding to the above are outlined, also within 3 months after receipt thereof. Number E, Eastern Cape Department of Rural Development and Agrarian Reform. In number 1, investigate to further support and empower small-scale farmers, particularly women, through training, access to resources, and linkages to markets. explore sustainable agriculture practices to enhance food security and encourage the uptake of undistributed vouchers. Number 2, collaborate with local authorities to explore and implement food security initiatives such as community gardens and urban agriculture projects to increase the availability of fresh produce and improve dietary diversity. Number 3, provide the Commission with a report in which efforts towards responding to the above are outlined, in this case, within 6 months after receipt hereof. Number F, civil society organizations and NGOs in the Eastern Cape. 1, investigate possibilities for facilitating data sharing with and between NGOs to provide information on households affected by severe, acute, consider advocacy efforts for policy changes that relax donor laws, enabling easier food donations during times of crisis, and ensuring that surplus food is redirected to those in need. Number G, Eastern Cape local municipalities and Eastern Cape COCTA. Number 1, explore the development and implementation of local food security policies and bylaws that promote community gardens, farmers markets, and food cooperatives to enhance access to fresh, nutritious food at the local level. Number 2, investigate the possibility of scaling the 39 municipal nutrition programs to cover more districts and wards, expanding their reach and impact. Number 3, provide the Commission with a report in which efforts towards responding to the above are outlined. Also, in this case, within 6 months after receipt hereof. Number H, Eastern Cape Provincial Treasury. Consider exploring options to ensure that the provincial budget allocations sufficient resources to address child malnutrition effectively, including funding for the ECD subsidy, the NSNP, vehicles for social workers, social assistance programs, and other nutrition-related interventions. Secondly, implement human rights baseline assessments before demanding return of funds earmarked to address child malnutrition towards responding to the above are outlined. Also here, within 6 months after receipt hereof. Eastern Cape Provincial Legislature. It's only 1. Explore avenues to strengthen oversight mechanisms to hold government departments accountable for addressing child malnutrition and ensuring the effective use of allocated resources. Number J, National Government and Office of the Premier, Eastern Cape. Firstly, explore opportunities for investment in research and data collection efforts to continuously monitor child malnutrition rates, understand its causes, and evaluate the impact of intervention in the Eastern Cape. Secondly, consider the possibility of declaring a state of disaster due to the high prevalence of child malnutrition in the Eastern Cape, enabling coordinated efforts and resource allocation for immediate intervention. The establishment of a dedicated war room or command center accountable to the Eastern Cape Premier's office with decentralized war rooms per district involving all relevant state agencies, Department of Home Affairs, the DOH, the DPE, SASSA, the DSD, to coordinate and streamline efforts in addressing child malnutrition. including data analysis and predictive modeling. Thirdly, provide the Commission with a report in which efforts towards responding to the above are outlined within 3 months after receipt hereof. The National Department of Home Affairs. Firstly, collaborate with the Department of Social Development to launch a registration campaign targeting unregistered children, ensuring their eligibility for social assistance programs, including the Child Support Grant. Secondly, prioritize the registration of infants under the age of 1 to ensure timely documentation. Thirdly, prioritize addressing the backlog in late registration of birth applications for all children under 18. Compile a table with the baseline backlog per Department of Home Affairs office and track progress in eliminating the backlog within a set time frame. Fourthly, collaborate with the Department of Basic Education and South African Social Security Agency, that is SASSA, to proactively register unregistered children in schools and on the SASSA system. Number 5, provide a table with details of the number of unregistered children per school and per SASSA office, along with your progress in registering these children. Number 6, report back to the Commission every 6 months on the progress achieved in addressing birth registration. And then number L, National Department of Finance. Firstly, explore feasibility of increasing child support grant, collaborate urgently with the Department of Social Development to explore the feasibility of increasing the child support grant above the food poverty line, ensuring it effectively addresses the nutritional needs of children. In closing, let us remember that the time for action is now. These are the rights of our children, the rights that shape our future. It is our collective responsibility to ensure that they are not denied the opportunity to thrive and to become the leaders and innovators of tomorrow. We extend our heartfelt gratitude to all who have joined us here today and to those who have been following this important discourse. Let us unite in our commitment to safeguard the rights of our children and work tirelessly to give them the chance they deserve for a brighter and healthier future. I thank you. I will then give the stage Dr. Carter allowed to be excused so as to continue with the inquiry that I'm having in the Mpumalanga province. And if there are comments and questions, I will humbly request you to take those questions. Thank you so much.
Thank you so much, Commissioner Sibanyoni. That is the conclusion of the findings and the recommendations of the South African Human Rights Commission's report into this inquiry. And yeah, we are now open to questions and comments from the members in the room and also those online. And Brandon, if you can perhaps look at the chat box as well as the hands, we will be discussing what the findings are. And if you have any questions, please feel free to ask. I think we've got one question. We've got a hand up online. Let's go online.
Estelle.
It's Estelle Ellis. Yes, can we have your question, Estelle?
Hi, good morning. Thank you very much. I only have one question, and that is about the Commission's powers to, if should government not abide by the recommendations, what is it that the Human Rights Commission can do to give effect to these recommendations?
Thank you, Beth. First question, maybe we can have another question in the room. Yes.
Hi, this is Toyota from Global FM. I wanted to know if you have specifics of the areas that are actually affected and also the types of households.
Thank you. I think firstly, in respect of Estelle's question, the powers of the Human Rights Commission, it's contained in our mandating legislation, and we have the mandate to take government to court and hold them to account, if we feel that they have not abided by the recommendations of our reports. However, we are positive that we're going to get buy-in on this national effort. There's timelines involved. We have had several engagements, and for those of you who have followed these inquiries, when we did the inquiry last year, government stakeholders came to the table. They presented. They agreed that we are sitting with a concern here. So we are very positive that government will come to the table to see how we can, as a collective, see that we need to address this very urgent matter. Because we do feel that the best interests of children, as reflected in international obligations in our constitution, and it's paramount. And we need to address this now. There's no time to waste here. So we're looking forward to working hand in hand first with government to see how we can come around the table to implement the Commission's recommendations. And then Estelle will take it from there. But I think for now, we're very positive that we're going to get buy-in, because surely if the rights of our children are not the most important, what is? In respect of the second question, yes, the report which we are launching today and which is going to be made available online as well on our website. Colleagues can also email us. Louisa, can we maybe just ask our colleagues to keep it down a bit? There are currently 39. There are currently 39 municipalities, local municipalities identified by the province as in need of crucial intervention. And indeed, those 39 municipalities are getting the assistance that is required from government. But in our report, which we will make available, you can also leave your email addresses with us. We can send it to you. In our report, we've identified that, well, the Eastern Cape is sitting in excess almost 700 local municipalities. 700 municipalities. So that's right. I think it's if you can get the numbers precisely. But we can't just focus on 39, because the poverty level in the province and the stunting level of children in the province, which is 25% of all children in the Eastern Cape, surely requires from us to maybe extend these programs above and beyond the 39 that has already been identified. So that is definitely part of the Commission's report and of the Commission's recommendations to look at the 39, but then to extend whatever efforts is already on the ground by all of these municipalities, and then provincial government lending a hand to these municipalities to say, we'll take it from the 39 and we'll scale the effort so that it reaches more children. Yes.
I have asked one time the Premier of the Eastern Cape to be increased so that it reaches or is above the poverty line.
So thank you so much for that question. So as part and parcel of the inquiry, we invited information and submissions from several stakeholders, amongst them UNICEF, amongst them the Children's Institute, Stats SA, we had CSIR here, and all of them presented information relating to the food poverty line. Now, currently, or at that stage of the inquiry, the food poverty line is at 624 Rand. Now, the child support grant is at 480 Rand. So 510 at the time of the inquiry, yeah. So let's say it's at 510 now, but it has never kept up with inflation. So still it is below the food poverty line. And the food poverty line measures at the most basic nutritional needs. And that, excludes even the other needs that our kids might have, clothing, that type of thing. So the recommendations are there, the analysis is there, but it is not for us to say, exactly how, but our recommendation, and as you would have listened to Commissioner Sibanyoni, is we are realistic. We know our country is currently in some dire straits in respect of the public purse. And we are very much aware of that. So our recommendation for consideration is that we might need to approach it from a staggered implementation phase. Why are we saying that? Now, the National School Nutrition Program includes kids from school-going age, which means kids from school-going age get that 1 meal a day. They have it. And in terms of the Eastern Cape, we've commended the department for a rollout of this program. I think it's around 1.6 million children who's receiving that meal a day. And even the expenditure, when we measured it against Treasury, the expenditure is good. That rollout is successful. It promotes going to school. It promotes academic performance. Now, what we've said, though, is that if we look at the disparity there, there's the children from 0 to 5, that cohort doesn't get that meal a day. So they just rely on the 510 or the 30 at that stage, which falls below the food poverty line. So in our view, there's a little bit of a disparity there. And if we have a limitation in what we can urgently implement, ours is to make a recommendation in terms of the social assistance, like I think is it 12A, to say let's approach it from a staggered point of view. Let's go to the 0 to 5 cohort first, and we make sure that theirs perhaps be increased first in a staggered approach, and when the public purse becomes more powerful, then we can recommend and we can roll out further. Now, the recommendation to align the child support grant is not, it's been made previously by international bodies as well, the Committee on the Rights of the Child specifically, who in 2016 said government must look at this and align it to the food poverty line. So ours is a call, and we align ourselves to that, and we say, even if in the bigger picture we're not able to do that right now, as we actually feel urgently needs to be done, we might look at a staggered approach to say, okay, let's cover the 0 to 5 first, and then we take it from there. Anything else? Anything online?
Yes. I must commend the Human Rights Commission for this report. I think it comes at an opportune time when issues relating to human rights are calling into question. And I think for me, it's known the first point that I found was spiritual. Malnutrition and poverty is a silent killer. Particularly between the ages of 0 to 5. And that the report is also making it, this shocking discovery. And I think it was UNICEF, estimates it between 1/3 of food that goes to waste. The report says it's 10.3 million. I think that's huge. This is despite the fact that food is still at a low, and have the necessary nutrients to actually, address the issue of malnutrition. 18 kids in Lusikisiki alone, died. I think it was between 2022 and 2023. Just one tiny municipality, and it is demonstrated in the report. I think those are some of the things that all of us have to grapple with. I'm trying to check just on the enforcement side relating to the recommendations. So actually, when we do private business, have to play in alleviating, because most of this food that finds in the land, is sourced privately and business have to play in all of this. And again, if we understand that this is a problem that is being incrementally developed, is it the lack of time on the part of government, on the part of society to actually deal with this issue, that is, affecting our foreign kids? Thank you very much.
First of all, I think the Commission must thank the University of Fort Hare for coming to the table during the inquiry and providing valuable information. We really thank you, because a lot of what we then came to understand was as a result of the baseline that you created for us. So on the Commission side, again, thank you to the University of Fort Hare for that assistance. Your question is so important with the comment that you are making. And I think that is why we wanted to come at this from more than one angle. Because I think you're referring to the CSIR data. Now, the CSIR data that they provided to the Commission was, in fact, that South Africa is not a food insecure country. We're not. But that on a yearly basis, there's about 10 million tons of food that land up in landfill sites. And that 34.3% of locally produced food is lost annually. And I think, Prof, that is what we're alluding to. On the one hand, we are starving kids. On the other hand, we have food ending up in landfill sites. Now, that is exactly the reason we wanted to host this inquiry and see where can we connect these two. One of the NGOs who came to present evidence as well, interested stakeholders, indicated, isn't it time for us then to make donation easier? And you've indicated there might be a role for private business to play. We agree. We do, however, know that municipalities have bylaws in respect of food donation. Now, one of the recommendations that we have made, and one of the legal announcement findings that we've made, is to look into that, to see during a case of disaster, which we are actually calling children dying of hunger, that we look whether we should not categorize child malnutrition and stunting at a national level of 27% as a national disaster. And in times of national disaster, whether we should then relax bylaws in respect of food donation. So what we heard from stakeholders were that they were afraid of repercussions when they donate food. So there's a resistance in making that connection between hungry children on the one hand and food wastage on the other. But, and you've mentioned, what is the issue? Is government capable of doing this? You would have noted in one of the recommendations, it's to call upon civil society to also take our hands. There's no way that any of us can do this alone. And we, number one, are there to support government. Number one, we are all in this as a collective to make sure that we take the different threads and we tie them up together to make this one strong connection to address this massive issue. And then we include civil society. Even the agricultural sector came to the table to say, you know what, we've got programs, but we can scale. We can scale. But one of the issues were that they did not necessarily know exactly where to scale to. One of the NGOs indicated that they've got this program where they collect food that is perfectly, still in use, but they just need to know where to take it. They just need to make that connection. Where are our kids that are presenting with severe acute malnutrition? And that's one of the recommendations that we're making here. We've called upon the Department of Health to make available data, not within 3 months, immediately to the NGO sector to say these are our hotspots. here's the 39 municipalities that immediately need assistance, and here's how we can connect you. So that link can be made immediately while we consolidate our programs, while we consolidate and take hands in terms of where we can strengthen the already existing programs. We see how we can get to those kids immediately, because it's certainly not something that we can progressively implement. We should be implementing it immediately as per Section 28, calling for that to be done right now. So number one, thank you so much to Forde. And number two, I think you'd agree with me. This is the connection of it's an intersectional issue. Connecting the one hand with the other, definitely not in silos, definitely not.
I know this is a bit offside, but I was wondering if you could maybe comment on the cases that have come up of suspected food poisoning in schools that are seemingly increasing to a point where children are dying because of, well, they haven't told us what is.
So I'd be hesitant to comment without all of the information available, but what I can reflect on is what we found in our report in respect of the information that was before us. Even the Department of Education, although those matters that you've indicated, I don't think pertains to the National School Nutrition Program. I think that was food that was acquired outside of the schools. But a comment I would like to make is that even the Department of Education indicated they still need to strengthen their programs as well to make sure that the food quality that is available at the MSNP is measured, and is measurable. And that is something that they themselves identified and that is echoed by the Provincial Treasury, who said that we need to make sure that the money spent in these programs are in fact value for money. Because what we have seen, and at Polisa next week will be tested, but can give testimony to that, is that when we have visited schools before, there has been complaints that unfortunately the same meals have been provided for extended periods may not reflect the nutritional value that is required, or the nutritional needs that's required for our kids to flourish.
And then the unspent budget of the Department of Social Development, do you have a comment regarding that?
Well, that's a big portion of the report. I'm going to provide you with that report, but again, and I want to touch on the food wastage issue. If we speak about progressive realization, and if we have a retort that says we do not have budget available or we have resource constraints, one must look at the other side to say, but why are we returning money to the fiscus? So that, dichotomy needs to be unpacked. And what we've done is we've engaged with Provincial Treasury. We've told them, consider a baseline analysis before money is being returned to the budget, whether that money isn't there to address basic human rights, basic needs. And then before you reallocate it to another need somewhere, perhaps you need to reconsider. No, we are not there to prescribe in terms of the PFMA or the MFMA. We fully know that our colleagues at Treasury are doing that, but we are calling on them to just do that baseline analysis. And Provincial Treasury did respond to our report, indicating that they have, they will be responding to us officially in 6 months, but they made a few comments as well, but fully supporting the report. Anything else? Is there anything online? Not yet online, please.
Just one confirmation, if on the report you do state specifically the type of households that are heavily affected by the problem.
I think we do unpack who might be more affected, but more from a general perspective. We rely on statistics that are available. We rely on statistics that were provided to us by Stats SA and the stakeholders who came to the table. We also had a look at the SASA numbers, and we also had a look at the numbers provided by COPTA and the Office of the Premier, as well as the Department of Health. So the Department of Health would have provided us with numbers of children who presented with severe acute malnutrition. Now that was I think it was about 1,100 children in the year 21-22. And I think it was about 120 who died of severe acute malnutrition. Now, unfortunately, the thing about severe acute malnutrition is we only present it too late. It is underreported. So when the kids get to hospital, it is a question of an urgent need. But we're not talking about the kids who don't get to the hospital, the kids who are not reported. So we expect, and that's the general view, is that it is being unreported. And when we look at the poverty rate in the province of South Africa, the unemployment rates in the province of South Africa, we expect it to perhaps be much higher. That is why instead of saying go directly here and there, the Commission is asking for consideration that the programs in fact be scaled to municipalities all over, because we expect and we suspect that this is a much bigger issue than it is presenting in data.
So that is point actually name the newspaper updated by us, but the non-status doesn't list them.
Yes, but that information is available in terms of DSDs and COCTAS programs that they are rolling out. So what we have to mention and what we've made and done so in the report, we commend the CSG, we commend the NSNP, but we feel that there's a greater need. Food poverty program. We feel that agricultural sector can come to the table again. We feel that underspending cannot go unaddressed. Because that's where our end users are. Now, the 39 municipalities here, they are available, and you'll be able to see, I'm not sure whether we mentioned them by name, but it was on our YouTube channel. The inquiry was live streamed as well, so everyone there presented evidence under oath, and the data would be available. Anything else? All right, going once, going twice.
To know if you have a recommendation of what the academia sector and the media sector that's here that they could do to assist in ensuring that this report, comes into, enforcement, advocacy.
Thank you, Zuki. I think that's a very important question. Some of the recommendations that we made to government is also to implement data collection tools. We need data. We're living in an era of data. We're living in an era where data is in fact modified, and we need to make use of data for us to effectively implement programs. So the data release is also just as important to allow institutions such as University of Forte to then take the data and do the analysis and come back with researched plans and programs, which in fact they have, and that goes to the same for a lot of tertiary institutions as well. And in terms of the media, you would have seen that there were a lot of findings, and there's legislation already available that just needs to be popularized. We need children to be registered at birth. We've seen that birth registration is crucial in order to obtain social assistance. Now, we also have a misunderstanding that you have to have a birth certificate to access a child support grant, which is not the case. There's a transition, there's a facilitation process where you can go to Home Affairs, you can go to SASSA, and then they can assist you even if you don't have a birth certificate. Then that process can be kicked in. But in the meantime, at least the kids can get assistance, the kids can get resources for them to be able to at least meet the most basic of their needs. So yeah, I think it's a massive role, and we call upon the media to play that role, and we call upon academia to unpack the report, but also assist us in going forward, so that this very important topic is unpacked not only locally, not only in Eastern Cape, nationally, but also globally. We align ourselves with what the African Charter on the Rights and Welfare of the Child says. We align ourselves as signatories to the UN CRC So definitely this is something that South Africa needs to address now. Kids only stay small for a very short number of years, so we have a limited space of time in which we can address their urgent needs. So with that said, I think it's 11 o'clock, we've come to the end of our session and our briefing. The report will be made available online on the Human Rights Commission's website. And thank you for joining us and supporting us in the work that the Commission does. Thank you so much.
Thank you for the full name.
Dr. Eileen.
Alcohol.